Well, thanks so much for the introduction. And despite the length of time that I have been doing this work, I don't want anybody to mistake that as an indicator of chronological age. My training includes some graduate work in anthropology, which was a first love, which sort of informs the way that I look at some of the school situations, because narrative and storytelling and the details of what happens is a real part of learning about what's actually going on in the schools. And I want to thank Dr. Paulson particularly, Veronica as well. Veronica has been exceedingly helpful. But for people who work like I do, which is for stakeholders or customers or whatever we want to call the people who are in the buildings themselves, we often don't have a voice in settings like this. And I think that this is a great opportunity for me and for them, and hopefully it will continue. And I think that the idea of children and adults in the schools, all of us, we are in the same environment. It was well said many times this morning that children are most at risk, and they absolutely are for a whole variety of reasons. But one of the things that I think is there's a good aphorism to describe what's happening, which is the children's learning environment is the working environment for the staff. So everybody's in this together. And in a way, the children are kind of the canary in the coal mine. So no argument or difference about that kind of thing. And one of the benefits of coming to a podium in the afternoon after lunch is that everybody who spoke in the morning, who said a lot of really interesting things, could be quoted by me now, actually could stand in for my whole presentation. So I might just repeat what everybody else has said. But we heard a couple things that I thought were of particular note and will relate to what I'm going to talk about. Keisha Reed said that the conference gives us a chance to expand the conversation about some of the real issues we're facing today. And I think that's right. And I think that we want to include more perspectives as part of that. She said that hands-on experience is, from those doing work, is much more important than textbooks. And I don't know how to judge that exactly, but I think there needs to be a blending of those things for sure. Jerry said that what we don't know about mold drives us nuts. We get questions all the time. It's the second biggest question hazard that we face, and the science just isn't there right now to answer the questions that all of us are asking. Francine, my colleague from the school district, and Megan, another one, ask questions that focus on that in a way, and they're my questions all the time. But what went with that is another statement from Dr. Leonard to apply the precautionary principle, which I think it kind of works with Dr. Paulson's statement. It is true, the science isn't in yet, but we kind of know what needs to get done, at least in part. There was the discussion about frustration with vaccine acceptance in a highly educated, highly compensated population of people. And the frustration seemed to focus on taking action with information. This is going to be a focus of what I'm talking about today. It's turning information into knowledge, into action. Because I have done this in the settings in which I work for more than 30 years. And maybe there'll be some argument about this, maybe not. The settings don't look better to me today. In the microcosm, they may. And for a variety of reasons. So New Orleans may look much better today than it did pre-Katrina. And there are places where things have improved. But overall, we're still talking about the GAO study of 95 being a floor, and we need $542 billion of work today. Anissa spoke from the Center for Green Schools, said that 90% of Americans think that our schools need to be fixed and need more work, that we don't have a good accounting of the conditions of these schools and what they mean, and that what she was doing was collecting information so she could give actors, decision makers, information, but she wasn't creating a repository of information and research. I understand that. I think there are a lot of people who are doing work. We need that repository of information and research. And I was talking to this gentleman in the front row, Andrew, about this, and there's a discussion about how school districts can get information they need that's practical, implementable, and cost-effective, and also protects children. So I think that there is something like this that we do need. The GAO, she said, and the AFT said that there's information that 15,000 schools have inadequate indoor air quality. My understanding of statistics with this population is that we have about 100,000 public schools in the United States, so we're talking about 15% of them. And in urban areas like the one I work in, those numbers are probably higher. In fact, I fooled around with the numbers a little bit, and thinking about the numbers thrown out here of $542 billion in need, and the 100,000 schools that are said to be in the United States, that works out to be some number that I calculated, $542,000 per school in infrastructure improvements. In Philadelphia, we have 200 to 300 buildings in play, let's say. And that puts us in the $1 to $1.5 billion need. We describe our needs as $4 billion. So taking that, maybe we in an urban area, the 8th largest district, have a little bit more needs than the average. But these needs are profound. It's a lot of schools, 15% with indoor air quality. There was a photo of the terrible conditions pre and post Katrina and the smiling child. What do we do? One of the big questions is, what do we do with the unsmiling child? How long does the unsmiling child stay in that school? And I think this is a big challenge for all of us. It really is. We see the conditions. At what point do we have to take specific action to change that? And Megan asked about what we need to do to have decision makers and policymakers take steps. And I think one of the threads throughout the whole morning was something about advocacy, the public, and stakeholders. I think we need to make these things very real. We've been talking about them a lot. I think it's time to make them really, to make them happen. So in my role as the acting director of environmental science and occupational safety and health in Philadelphia for this large union that represents 15,000 or so people, it's my obligation to ask those questions and to drill down on those questions, actually, to find out what we're doing to evaluate conditions and that might negatively impact on the health and safety of staff, and to find out what kinds of information is being collected, where's it going, what are we doing with it, how are we acting on it. We seem not to be able to learn as well as we'd like from what we have done in the past and use it as we move forward to the future. We have a lot of information from a lot of unconnected sources, and we have a hard time trying to coordinate those sources and to make sense of this. We have a lot of signal. We have a lot of noise and not much signal, and we need to reverse that. And decisions, I think, are still made a lot on instinct, gut feeling, and a sense of what's right and wrong. And that's why I think sometimes we fight and we argue about this, because everybody's working hard to do what they think is best, but we're not using the data that really is out there in the way it's supposed to be used. And so we end up in very different places about these kind of things. It kind of reminds me of Moneyball, where the very popular movie focuses on the change in baseball, where data-driven decision-making really is implemented and makes a gigantic difference. So the bulk of my presentation is going to be framed not so much by the detailed nuts and bolts of environmental assessment, but we will talk about that, but more about the desperate need for what I see as four things. One is information acquisition and aggregation and analysis. We need to really figure out what we have and what we're doing with it. We need to really collaborate. Information and no collaboration, it just doesn't work. Collaboration's hard. People feel differently and they have very different perspectives. It's easy to get angry and frustrated and to miscommunicate. We need to involve all the voices. Otherwise, I think it makes it almost impossible to move forward. Accountability is something that gets talked about all the time. In my world, what I see happening with accountability when there are different voices being used in discussing it is that it sounds like blame. It's not accountability. I'm being blamed for something. You're not, when you want to hold me accountable for that, it's not my fault. I didn't do that. And that ends up stopping the discussion. For me, accountability isn't about blame. And if I was blaming somebody, I should be stopped. What it's about is really understanding where we have problems and fixing those things. We can't do that if we don't say to someone, hey, that's not working. My friend here said that one of the things that gets done is information comes in, a school district says, hey, I have a problem at a school, can you help me? Yes, I can help you. I'm going to tell you you should do this, 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 and this. And I said, who do you say that to? And he said to the chief operating officer or the superintendent or the decision maker. And I said, okay, what happens? And it's unclear what happens because the decision makers often are thankful for that information. They want that information and they use that information, but they might not fix that condition because there are other things that are going on. We don't know what happens in that case. We don't know if we're effective or not. There's a piece that we're missing, and that piece is the advocacy piece that involves public, it involves teachers, it involves parents. It has to be part of this. So that's how I wanted to start this. What I decided to, I want to say one last thing. This is sort of to kind of blame all of us. There's a very interesting book that was written called Thinking Fast and Slow. And some of you might be familiar with it. The person who wrote it is an Israeli economist who won the Nobel Prize in economics. And basically what he said was that, all of us are genetically programmed to think fast. Instinctive, fast, and emotional. That's how we grew up as a species. If we didn't do that, something grabbed us, threw us to the ground, killed us, and ate us. So it didn't make sense to figure out if you shouldn't run away. Run away. If what you ran away from was a rabbit, well, you just ran away. But if you ran away from something dangerous, good for you. Thinking slow is in another part of the brain, and thinking slow is something that's more considered, deliberative, logical, whatever else you want to say about that. It's a very hard thing for people to do. We don't do that. So we make decisions quickly, we look at people, we decide, and then that's what we act on. So I think what I want to show you here right now are the job requirements for our new superintendent. He was hired 2 or 3 years ago. And one of the things that you're going to see as you look at this is that there's a commitment to transparency, a commitment to openness, and a commitment to responding and including stakeholders. Nobody's disagreeing with this stuff. This is great stuff. And this is what our job requirements were for the new superintendent, who also had to comply with these core beliefs. And those core beliefs are talking about partnership and engaging everybody again, and leadership and accountability. Again, there's no argument about any of these, and nobody would walk away from any of these things. We know these are right. And here's our mission. And when we look at our mission, again, we're talking about involvement and here social justice. I think that we all want to be held accountable to the statements that we're making. And that's for everybody. And that's what kind of formed what I wanted to say here. So, well-spoken intentions, for sure. And this is what we want to say. Sometimes the intentions don't get us far enough. And we know this too. There's nobody should be questioning anybody's intentions. This one actually was the first slide that I pulled out for the intentions. I just liked it. And so I left it in there. This is something that Churchill said. And it's a statement that I didn't realize that Churchill had said it. It's something that I unfortunately do. And so my friends and colleagues from the school districts that I sometimes work with find me to be a major pain in the ass because of this. But then when I found this particular quote, I thought, all right, that's great. I mean, Churchill said it. You know, I've thought a lot about health and safety, and I've worked in health and safety for a long time. And I actually do a lot of construction safety. And I used to joke around, maybe inappropriately, about the difference. The worker who goes into a work site with both of his or her hands and walks out with one of them does not know that it happened at work with the saw that they were using. But with health, we often don't know. We can't connect those things. It's much harder. And so I just grabbed some of the recent Bureau of Labor statistics about this that shows that the difference between the deaths from workplace illness, and from safety hazards and injuries is tenfold. What we have in our schools is a major health issue. There's a safety issue too, and we deal with that safety issue in a whole bunch of ways. So when I started thinking about safe and healthy schools, I'm a parent. I have 2 children of my own. I live near a public school that when my wife and I took care of a child from overseas, we sent to this local public school. And I think about these schools a lot, and the questions that I have are, is it possible to achieve our mission, our core beliefs, and our job requirement descriptions if we allow bullying and fighting to occur in the school? I mean, and I mean this again practically, and if you think about it, I went to Philadelphia Public School, and there was a lot of bullying and fighting. Some I participated in. Sometimes I was bullied, and sometimes, but the thing is that when you really put your mind to it, the amount of bullying and fighting is relatively small compared to the population at risk from illness in our schools, because everybody's at risk to illness. So, but you wouldn't tolerate bullying and fighting in the schools. We call it a zero tolerance policy. How about, would you allow violent behavior or weapons in our buildings? Of course not. You wouldn't say that we don't have enough money to take care of that, or if you did, you wouldn't say that we could educate our children properly in those buildings. I'm making the argument that the 2 issues at the bottom look just like that. There's no difference, really. We can't have asbestos and lead exposures that matter in our schools. You can't do that. And we can't allow air quality deficiencies and mold and those kind of conditions to exist. And in fact, in your home, if you didn't have the money to fix your roof that had a leak, and you were sitting in your kitchen and it was leaking on your head when it rained, you would do something to fix that, even temporarily, knowing that it might cost you $100 to fix it, and then $100 next week, and $100 the next week before you paid the $2,000 to fix it. So now it's $2,200. But you can't not fix it, because it doesn't make sense to not fix something because you're waiting to fix the root cause. Okay, you can't do that. So what I'm going to try to walk through today is to look at the scale and the scope of the problem, to talk about the implications of these conditions from a social justice and equity perspective, to look at the real need for data-driven, evidence-based decision-making and sustainable practices. Again, to talk about the need for collaboration and how to do that, and some practical and implementable cost-effective solutions, because they exist. Sometimes, and this is a quick preview, the capital program for a school district want to have a lot of money. I'm Baltimore, or I'm Maryland now, and I can put in very high quality ventilation systems and control technologies that have carbon dioxide sensors and humidity sensors, and it's unbelievable, and it complies with LEED Gold and Platinum and Silver, and it's great. But I have the money. I'm the capital program. I don't have the money. I'm the maintenance department. And maintenance of buildings is about 80 to 85% of the cost over the lifetime of the building compared to a capital cost. This is well recognized. So I put in the high-end system, but I don't have the money to maintain the high-end system. One cost saving is maybe not to put in the high-end system. You want a system that works, but maybe not the high-end system. We'll try to take a look at some of that. Okay. This I'll try to go through kind of quickly. The scale of the problem, we're talking about 100,000 schools, 33 million teachers, 55 million students, 1,300 hours per year. It's a lot of exposure. The buildings are often old. In our district, we're 20 years past the average age of schools across the country. 40 years in this, and we're 60 some years. It's a problem. It may not be the major problem, actually, but it's a problem. We have old surveys, nationally and locally. And we have old data. And I'm going to add something that I'll come back to at the end, which is one of the things we're going to talk about a little is big data and how we can use that without it being a sort of just an empty kind of buzzword and phrase. Well, you know, there are 4 V's that are usually connected to big data, if you're familiar with this. One of them, the most common, the most recent V is veracity. It's a V that we've looked at a lot of times. Now I have a lot of data. Is it good? Do you have any idea if the data that you stuck in there has any value really? It's just a big issue. We'll look at these 4 V's. 95 is the GAO report. In 97, Clinton puts out an executive order that I think is what drives a lot of what people have talked about today. Every federal agency has to do all kinds of things to protect kids and to take steps to do a whole bunch of different stuff. And in 2013, it looks like, you know, not only do we have poor conditioned schools, but as was pointed out earlier, there are implications for not just health and attendance, but also achievement. So the costs, I think sometimes we're not thinking about what all the costs are when we start looking at this. I think this is the lead into part of the 2013 State of the Schools report. And, you know, here again now, whatever it is, 13, 16 years later, we're talking about the lack of equal opportunity and maintenance and modernization. Something's wrong. We're doing something wrong. This isn't a school. But is this a thing is this a saying that people know? Right? So broken windows syndrome doesn't usually talk about schools, but I've been thinking about it a lot that way lately. So in this building, did this building get like this because that window was broken and not fixed, and then the next? Whatever it is that's going on, the problems that we have in our society, which are huge, shouldn't stop us from fixing the window here. When we fix the window that cost us $400, we know it's going to get broken again, that someone else is going to throw a rock through the next window. And they do, or even the same window. And we don't like doing that. We hate paying that money over and over again. But if we don't, once the rock goes through the window, then comes the rain, and then come the rodents, and then the next rock hits the next window anyway, and pretty soon our school looks like this. And what's in the hallways are buckets to catch the water. And that's what was shown earlier this morning. Oh, I lost my... So I found a lot of good Churchill stuff. So this was after the bombing of the House of Commons. And, you know, there's talk about what do these buildings mean. And I really was struck by, I'm sorry, I think you guys, no, or maybe right before you, it was the person from the Green Building Council who showed the picture of the kid who walked into a school that had just been renovated. And I think this does matter. This is a bit of a messy slide. And all I meant to try to point out here is to look at Maslow's hierarchy of needs in a school district sense. What we want to do is this thing at the top. And that's what we talk about. And in our district, we talk about it all the time, too. Everywhere does. What do we want? What's the goal? It's highly achieving schools, high-quality education, social justice, and fiscal sustainability. And those are what we should do. But how do you get there? You can't have the other stuff going on and get there. That's why it's a pyramid. this is what happens. Like the building, I think, pointed out, this is often what happens when we don't take care of one thing. It does hit another thing. So I'm going to come back to the same kind of school example. The high-end complex system gets put in to control the ventilation system. When one of the sensors fails, when this particular kind of sensor fails, and it does with some frequency, every 6 months or so, like things do, one thing that happens is, and nobody recognized it initially, is that it drives a damper that opens and closes to let in fresh air. When it fails, which way do you want it to fail? Do you? Okay, so it failed open on November 30th after it was put in. But for reasons that are also, we can talk about a little bit, the computer technologies didn't pick it up, or the people who were looking at it didn't pick it up. So January 3rd, in that fully open damper, frigid air came in and it froze the coils and ruptured them, and there was a giant leak and then mold and that kind of thing. That's what happens. So that's what we're talking about with cascading failures. You need to know what you're putting in place and what's happening when you put it in place. So we do need to drill down to a granular level to really know what's going on. I think somebody said something about getting lost in the weeds, and I might during this, but sometimes we have to muck around in the weeds for a while to see where we lost what we lost. So this was my foundational, cascading, consequential. We don't have good coordination within departments and school districts. I actually spent some time in some school districts in Washington, Baltimore area with the AFT. I've spent time in Philadelphia and in New Jersey. This is a common picture because we have some separations that we shouldn't have. We don't connect capital often with facilities, with IT, with academic. What happens is we sometimes don't put in the right designs for what we need, and we don't coordinate it with maintenance activities properly. We don't understand how to operate the systems, and sometimes we don't have the money to maintain and support those systems. We don't commission these buildings. Does everybody know what that is? I bought this architect and this contractor and all these people to build a $20 million building or install a $5 million air conditioning system, just like you put your roof on your house. And they did that. It just doesn't work the way it's supposed to work. And it doesn't work for reasons that are complex and who knows what. This is the commissioning agent I hired too. She's an extra. And she looks at what they did and what happened and says, nah, that didn't work. She says, that design wasn't right, so they catch some things at the front end. She says, those air handlers you put in, they're not working as they were specified. That's called commissioning. We don't do that. And we don't often learn lessons from this happened here. Can we use that so it doesn't happen there? We don't know how to capture the data and get it out so we can see that. We don't want to not see that. Delayed responses, problems worsen. What was a $400 fix is a $4,000 fix and then a $40,000 fix. And then the accountability blame happens. It's your fault for not fixing that fast enough. I can't fix that. It's your fault for putting that in. No, it's your fault. And I don't know if you folks have seen that, but we see that a lot. We have frequent inspections, sometimes Band-Aid fixes. They may or may not be effective, but even when they're effective, they have to be redone over and over. It's a Band-Aid. You have to take it off and put on a new one. That's what that means. But we don't do that. And so it gets more expensive, and bigger Band-Aids are used. And it still doesn't work, and it gets more expensive. And the costs skyrocket, tempers flare, people get very angry, they're in the buildings, it becomes a mess. So do we get educational achievement and fiscal sustainability from that? No. I showed these images at the APHA, and I was sort of surprised at the surprise of the physicians and healthcare providers and researchers were there. I'm interested to know if you are surprised by them. These are our occupied schools. And this isn't telling tales out of school. This is showing what it is we have. If we don't see what there is to see, we don't know what to do. This is a school in a poor African-American neighborhood. This is 95% African-American students. In our city, we believe that the asthma prevalence is somewhere between 20 and 30% in that population. There are 600 students. You're talking about 150 children. Are these asthma triggers? You're only seeing a piece of it. Whatever they are, what does it mean? And this is what I was asking the pediatricians and the physicians. Yes, Francine?
Just a quick question.
Yes.
Actually, a comment.
Well, do you want me to keep that one there?
Yes.
Okay.
Just as, since I worked for the school district in Philadelphia, you mentioned these are Philadelphia schools, you've been doing this for 30 years. I've been there for much less time than that. We identify those conditions together, and they've been fixed, so it doesn't look like that anymore today.
Oh, excuse me one second. I'm sorry? Francine, do you want to stand up so you can be heard?
So I went to Philadelphia School District also, and I just mentioned that Jerry indicated he's been doing this for many years, that's three decades. I've been with the school district much less time than that. We discovered these conditions together. We're doing a lot of inspections these days, doing a lot of assessment work to make sure that our schools are safe and helpful for children. We find a lot of conditions that need to be fixed. I just wanted to mention that these conditions don't look like this now. The picture was taken, and we did something about it. So I just want you to realize that when we do a discovery, we do something about it. The water intrusion issue there is a brick pointing problem that will take a lot of money to fix. So we do a lot of stabilization work at our schools. We have to go back, we have to scrape, paint, plaster, unfortunately, until we can get that capital improvement in there to fix the masonry structure. But I just wanted to mention that those conditions, do you agree? I mean, that has been scraped since then and stabilized.
Well, I think that there's not much disagreement between me and my colleague. I think that what happens with these conditions is sometimes they persist for months and years. I think what Francine is saying in when we see them and we work together, we address them. But the thing to understand is that these kind of conditions are not invisible to anybody in this room. They weren't invisible to people in the building before we saw them. So there's no disagreement. I think that, again, it's one of the things that...
One more thing, please forgive me, but when we did discover these conditions and we're starting to see it as a chronic issue, we have incorporated this type of inspection into our mandated regulatory compliance inspections for asbestos. Even though that wall does not contain asbestos, we're now doing mold and dampness inspection work with our regulatory required work. I mean, I do take this as, my professional work. I don't want you to think we're looking at this and we're walking away from it. Thank you, Jerry. Sorry.
No problem. In the interest of time, I'm going to move along quickly, but I want to show you this, where you have conditions where you have steam leaks or other kinds of situations like this, you have these consequential effects that can happen. One, you have energy loss, and two, you have moisture and dampness that can lead to mold. And I think, as Francine is saying, you do want to fix these things quickly. And so when we're working collaboratively on these evaluations and we're responding to these, I think they do get fixed. They do need the voice of everybody to do that. This is what I'm trying to point out here. You might be able to see it there and there. These intakes have been sealed off. They were sealed off. In part, they're sealed off as the best effort of somebody to address that issue of the broken dampers. So we have the dampers that won't close and freezing air that comes in, and we don't want to freeze the system. In this building, we have a school where the top floor has been abandoned because of roof problems. It becomes a roof. And what you see is some damage that gets done on the floor below because now your roof is sort of wet. So you have to maintain your roof, wherever that roof is. At the bottom, you see the kind of damage that can occur left unchecked with water on wooden floors. And so you end up with a much more costly kind of a repair. It's a library where the library, sort of like the school we saw in New Orleans, the library is still being used, and we're trying to deal with the problem. And the idea here is it really is not to do anything other than to shine a light on what it is that we see, because part of the problem, I think, is that not everybody sees it. And if we saw it a little more clearly, I think we might react a little more robustly. I'm going to stop, I think, with the photos with this one. You're seeing a couple things here. One is you're seeing something on top of tiles. And so you may have a hidden and initial kind of condition that occurs. So you might see this, but what may be going on is something more like this above it. So you're looking again at a sentinel event, perhaps. And although this doesn't show it, you can, this bottom right photo shows a couple things that happen that is, again, the drilled down granular level that we need to deal with. Sometimes there's a leak and somebody comes to fix a leak. And when they fix the leak, they fix the leak. But the leak fixer may not be the insulation placer oner. And so the insulation came off, the leak gets fixed, and the insulation may not go back on, and therefore you have condensation and further leaking. Now again, as I think Francine pointed out, and this is exactly right, these are the issues that as we discover them, we try to fix. Okay, and so just in the interest of time, the kinds of questions I think that this raises is this isn't what we want parents and students to be doing. And all of us in urban environments, I think we see people leaving cities a lot of times, young parents leaving cities, because they think the conditions look like I was showing and that they're representative. And they are to some degree. And to the degree that they are, this is what we can all agree on. This is, I'm sorry, the slides, this is our kids deserve better. Yes, they do deserve better. How widespread, the questions for people in here, I think, for all of us, and for us at the school district and the stakeholders is, how widespread are they? Were these like cherry picked out of the 150,000 areas? There are 3 of them that look like that? Or there are 73,000 that look like that? There are many that look like that, and they vary, but you can imagine it just by thinking about the GAO data and what was said. I mean, think about, the average would, for our school district, might be $1.5 billion in needs, but we have $4 billion. Inadequate air quality is 15,000 schools around the country. You can start to think about the conditions in our buildings. And nobody would deny, I mean, this is what $4 billion in needs means. We need help. This is what gets us in trouble. Whose fault is it? The teachers' union fault? They destroy the schools? They destroy everything? Maybe. The charter schools? Maybe. Who's the us and them in this? We're really in this together. This is sometimes how we treat each other, but we really are in this together. It's a challenge. It is a challenge. But we need to get past this kind of us and them. The money issue, I think, sometimes is a tricky one for everybody to get a handle on. We do have an extraordinary amount of need, and we do need money. When you need money, you need to more carefully and more efficiently spend the money that you do have. And I think this is where we actually contend a little bit, is just how do we work together to spend the resources we have in the best way? Again, in the interest of speed, I'm sorry, because I know that there's time to be left for questions. You all in here are probably familiar with asthma being on the rise and the information from the World Health Organization and the Institute of Medicine about asthma rates and about building conditions and about biological agents tied to persistent moisture and dampness. And we've got a large district here in Philadelphia. You have a large one in Baltimore and Maryland. We have limited data and information. I do want to say, and this is part of what my colleague was talking about, in a joint fashion over several years, we collected a lot of information about schools. Reactive information, a complaint and an investigation and response, and then a proactive evaluation. The proactive evaluation with the CDC NIOSH, where we looked at about 92 to 100 different schools and did hundreds of evaluations and looked at 160,000 components in rooms. We looked at dampness and mold. And I'm sorry, yes?
Did that program get shut down? Did I read that?
I think it is. So there are several programs that were going on and in the process of going on. One was this dampness, mold, visual assessment. What are the conditions of buildings? I don't know the status right now.
Ongoing.
Okay, so that one I didn't know the status of. There's a survey that was going to follow up on it that was to look at the conditions in 50 elementary schools in detail and to do some survey of 5,000 people for health. That one is at least temporarily shut down. I don't know the exact status of that. And so I think we're still discussing that. This is the kind of form that we're using in a more sophisticated way to collect visual information data. And what I'm going to do is this is the kind of thing we put together for the reactive inspections. We list rooms and problems and responses and that kind of thing. So very detailed at that level. We have data silos. And here's what I'm going to do. I'm really sorry, but I'm going to rush through this to show 2 or 3 last slides. This is one of the things that I've been thinking a lot about, and that is to put together all the sources of information. So one of the things happening is that work order information and capital information and IEQ reactive information and mold information here and this information here sits in these different silos. We need to put them together. And we need to look at them in a very coherent and aggregated way. I'm talking about everywhere around the country. We don't have this kind of information put together. These are the 4 V's of data. This is what sometimes stops us. The volume, the amount of data coming in. One of this velocity, the sensors, this is a new kind of data. We have sensors in many schools that look at, again, damper operation and thermal control and all kinds of things. I don't know of them as being fed into this same aggregated system, but they would be a useful kind of thing to put together. These predictive analytics and the kinds of tools we have now would allow us to look at this stuff in a much better way. Collaboration and community engaged research. I'll go through this quickly. We can have a system like this. We can have a system like this. We can have a system like this. Obviously, we want to be working together, and that's what we want to be doing. Churchill was really a font of wisdom. I don't think that he actually lived up to this particularly, but he did say it. The principles of collaboration, what's happening here for me with this is that we have all of these statements and intentions and ideas about working together, about collecting data, about evidence-based and data-driven decision-making. We have schools that are suffering. We need to fix those. We need to do that together. That's really what this is about. Thank you, and if there are questions, I'll take them, and yes? Well, so here's the thing. These situations, I think, exist for quite some period of time until we see them, where we see them in a formal way. In that school, we think that it was, for an extended period of time. But it's hard to know because when we didn't see them, we didn't see them. So we see them on a particular date, and you look at the condition and you say, that didn't happen yesterday. And then in terms of litigation, there is something going on in one of the schools, but it's not related to the conditions in the building. Yes?
I actually have 2 questions. Hi, Fran Burns, School District of Philadelphia, Chief Operating Officer. I've been with the school district for a year now, but have been working in Philadelphia for about 18. Love having come and fallen into education. And actually just also want to commend Francine Locke, our environmental director, her team, Jerry Janot and Megan, for the work that they do because it's outstanding. 2 questions in terms of, and then a comment, just 2 questions in terms of what I've heard today. And one is, definitely if you follow anything in Philadelphia, you see that we're struggling financially yet again. But there were times when we weren't. And those times, at least from a capital program investments, weren't so long ago. So 2006, in that area, we were spending
$320 million a year on capital investment, about 100 to 150% what we're spending today, more than. So, Jerry, just in terms of your having been in this role and with the school district for 30 years, I'd love your perspective, particularly if you come upon money again, back when it was, not only 5 to 10 years ago when that spend met, how with a infrastructure, 214 buildings, 65 year age, what spending occurred then? What spending maybe should have occurred that didn't? And is it that you get people in and they go for the big and shiny and what their vision is in terms of what buildings should be? I think that's helpful just in terms of perspective looking back. I'd love to hear that.
Well, I think that's a great question, and I think it is part that. One of the things that Fran, it seemed like mattered to me was the collection and use of data in a really in a clear and logical way. And I think that to some degree we've never really done that as well as we could. And so sometimes what happens with that money is it did get spent on the big and the shiny systems that we might not be able to maintain going into the future. And it also, because we didn't have good information, I mean, Francine, the Director of Environmental Services, has been with the district for 10 or how many years? For 9 years. And so we didn't have all this information before. So where do we put the money, I think, was harder with that pool of $1 billion. Do you fix schools or you build new ones? What do you do? So we didn't do that very well, I think. So and we don't do as well as we should with pulling in all these perspectives so we can tell. But that's what I would say.
One more question on kind of on the eyes and ears, because we have in thinking about how do you see that but not say it. And and I think part of that is sometimes you're walking into something every day and you don't even see it anymore.
Absolutely.
So just in terms of, from my role, I understand. We're trying to work on the building engineer seeing it, the cleaners, the custodians. But how about on the teacher side? And what kind of work happens there through you to identify and then report and react, and so that they see it every day?
So this is also it is a great point that hits you in the face when you see the conditions in that building or any of these buildings. How come I didn't hear about it? So without giving a name, I'm going to tell you from the teacher's end what I know, and I know this from all ends. It's one of the values of the boots on the ground approach. There's a lot I don't know from up here. I don't know the macro level, but I do know this level. My cousin, who's a teacher, said when she complains about the conditions during Thanksgiving, and I said, so how come you didn't call me? She said, I've already made enough of a pain in the ass of myself and in complaining, and this is at the school level. This is, I think that Fran, what happens is we're stuck in it's a tough situation. And so, in fairness to everybody, the question is, if we can't solve this, the complaining about it is going to put us at some risk. And that risk is it's just people don't like us, or they are angry at us, or they tell us to stop, to go away. I think this is a lot, though, what happens, because I don't know how you see that part, but we can't make sense of the condition and the lack of report. We can't make sense of that. Other than that, I think. So my fault as well, no question.
Question from an individual in the back said, I think you asked the question, how long were children in that classroom with those conditions? I wanted to let you know that we do take it very seriously. If there is an environmental health condition, mold, dampness, it's remediated within 24 to 48 hours if possible. The pictures that Jerry showed, you're probably thinking, why is the school district of Philadelphia keep asking questions and responding? It's because one thing that wasn't mentioned here is the many wonderful programs that we have in place. We have an indoor environmental quality program that is probably one of the best in the nation, modeled after the Tools for Schools program. We have an indoor environmental quality committee that meets bi-weekly to discuss the issues we're identifying in the schools. We do proactive mold and dampness assessment work. We have a chemical management program. We're doing some really wonderful things, and it really just wasn't represented here, so I feel a little bit bummed out over the way our school district was projected. That's all.
Hi there.
Hi.
Just a quick question.
Sure.
For the presentation and the assessment tools that you were using,
Yes.
one of the gentlemen had mentioned that that assessment tool is no longer into play. How is the NIOSH assessment for the mold and dampness still not being used, or is it ongoing?
You mean at the Philadelphia School District or generally?
No, I mean in
You
general.
mean general,
Yeah,
right.
it's not. It's not a.
No,
not a
no.
specific question. It's just a question of if we're collecting data.
Yeah.
If we're collecting data,
Yes.
and that means to be one of the key points that we're focusing on in here, as far as how can we collect data, how can we put our feet on the ground, what assessment tools can we use on a national level?
So I think what's happening with the assessment tool is NIOSH and the CDC have developed it. It looks kind of like this. We've worked with them, the district management, and we've worked with them in order to develop it and to focus it in a more improved way. And they've worked with us on that. The tool is available to be used on tablet computers, so it can go out into the field, and data is going to be collected directly. NIOSH, like a lot of us actually, not a lot of you in here who are really young and vibrant, are a little slow-witted on some of the data kind of stuff. And so it's taken longer to get it into the right form. But right now, NIOSH is working on an application that can be put onto phones. And you could imagine that in a way, overnight, the application could be sent to or shared with everybody in the United States tomorrow. And the next day, you would have the conditions assessments like this for everywhere in the United States. And so, those kinds of things can happen. And so this approach is still used. I think it's valuable. I think Francine does. And so I would say that from a bunch of perspectives, it's a valuable approach. I think it's worth doing for sure.
Jerry, call me so I can use the microphone.
Oh yes, please.
Okay, I feel disingenuous because I own the microphone. So
Yeah, I yes.
So Tracy Anger, EPA, Indoor Environments Division, IAQ Tools for Schools. So we've been coordinating with NIOSH to use this assessment tool to go the next sort of as an augmentation to part of the mold assessment tool that we have in Tools for Schools. And so I would encourage you, this is the school assessment session. So for those of you who are not familiar with indoor air quality tools for schools, I would encourage you to go onto our site, take a look at it, because part of what we talk about here, the collaborative approach to assessment and how is it that people can see this and not see it, is we do get trained not to see this stuff, and as part of that tolerance that we expect from schools and in schools, and well, that's kind of always been there, or of course that ceiling tile is stained because we all went to schools with stained ceiling tiles, right? And so, but what the assessment for the different checklists that you have in the kit do a couple of different things. One, it makes assessment a little bit more simple for anyone, right? So if you have we have a walkthrough assessment sheet, checklist that you can use. And it's also a collaborative team approach. So it means that we encourage the facilities person and the school nurse and the food service people and the school bus drivers all to do this together, so that then you're making a collective case when you go forward. And on a larger scale, that's what Francine is talking about too. On the district level, you can do it on the school level or on the district level. So we have districts all around the country and mentors who can help you with it. But it starts that collaborative conversation that allows an assessment to be a walkthrough and not what one principal called it, a drive-by. And that is what we talk about with the whole blame game thing. So it demystifies that process and creates a collective process, which is really important, giving people the eyes to see it, and then the ears to hear it. So that we have one facility guy who says when he hears the teacher who keeps complaining, he used to think, what a pain in the butt, right? But then once he started doing this, he realized, no, that's my canary in the coal mine. That just because everybody else doesn't sense it, the people who are most sensitive often are going to be the ones that identify something before anybody else. So use the tools. We do have the assessment tools there for people at every level.
And just so as the wrap up, I think I'm going to second this. Collaboration is really whatever else we do, working together to figure out what's going on and having different points of view and pushing each other is what this takes. This is what's missing. It's missing between practitioners and researchers. It's missing at all levels. It really is. We need to do that. And the thing is that collaboration and its effectiveness, I get to call that. The decision maker and policy maker does not. You're not collaborating with me, you decision maker, policy maker, because you say you're collaborating with me. you're collaborating with me if I say you're collaborating with me. That is, in terms of understanding what's happening, the people who are being, quote, collaborated with need to understand and feel that it's collaboration. And so it's a back and forth relationship that we need, especially to solve these problems. Absolutely.
Well, I guess Jerry or Francine, how do you get legislators involved? I was looking at the news article that the Philadelphia was closing schools, but was building a $400 million jail. So how do you get the legislators' ear to know that this is an important situation?
So my view is actually, I think, is highlighted a little bit about what's going on here, which I think is interesting and very productive, which is it's important to make visible what is invisible right now. What are the problems with our schools in detail? What do they look like? This is everywhere. What do we need? What are we talking about? That needs to be put in front of the legislators to say, this is what we're talking about. Sometimes the big numbers don't always do it. And so we're letting people off the hook, the funders off the hook. I think, fixed or not fixed or whatever the conditions are, let's show them what it is people are facing each day. I think it might change that conversation. Thank you.